you point out a very important point. We would call this a teleological perspective. It's asking the question, for what were you designed? I had a patient in here a couple of weeks ago. I said, is there any part of your body that can't heal? And she goes, no. And I said, well, except those pesky discs. They don't heal, right? And she said, well, that sounds dumb. I said, it is dumb. This belief that it can't heal, we have to provide an environment where it's going to heal. And again, as somebody who suffered from 2 disc herniations myself, they do heal if you get after it soon. If you take it seriously, then you don't have to take it even more seriously later. But it's about creating an environment in which this thing can heal. And blood flow to the disc is very limited. And so we have to provide an opportunity for the blood to get there. We use a class 4 laser. The class 4 laser we stole from the veterinarians who've been using it for multiple decades, long before we ever did. And their rationale was sound. They said, well, dogs don't rest well after surgery. And I say, I have a lot of patients who don't want to be in that situation where they have to rest well. You can't tell a dog to lay in bed for 2 weeks. It's never going to listen, right? Well, patients, as it turns out, don't really want to do that either if they don't have to. So creating that environment with a laser, with the decompression, and that laser can kind of sound scary. It's not surgical, but it stimulates something called mitochondria, which are already trying desperately to heal you. It's just there's not a lot of blood flow. So that laser brings new blood flow, brings new activity to the mitochondria, helps you lay down collagen way faster, and so things can heal.